Now, one thing you're probably familiar with is that adenoidectomy sometimes causes VPI. It can cause VPI because there's a sudden increase in the nasopharyngeal dimension, and it may be that the velum can't make up the difference in space. Therefore, we end up with either hypernasality and/or nasal emission due to this VPI. Now, the interesting thing is that it's not uncommon for hypernasality or nasal emission to occur immediately after an adenoidectomy, but that usually resolves within about 6 weeks. If it goes 2 months or longer, then we suspect that this is going to be a permanent problem, especially if there was a history of cleft palate or if we find that there was a submucous cleft that wasn't previously identified. Now, this is an interesting thing. We sometimes get referrals from ENTs for speech therapy for children who have post-adenoidectomy hypernasality. And that's never really made any sense to me, because when you think about it, if the speech or the resonance was normal prior to the adenoidectomy, then you change the structure and it's abnormal, why would speech therapy be effective? Because the problem is obviously a change in the structure. And in speech therapy, we don't change structure. We can only change function. All right, so I think that perhaps ENTs are thinking that we have some exercises that we can do to try and change the dynamics of the velopharyngeal valve, but that doesn't even make sense because exercises will not increase length. It won't increase the length of the velum, so that makes no sense. Even if you bought that argument that exercises were good and would be helpful in improving velopharyngeal function post-adenoidectomy, let's just think about what happens when we go to the gym and do exercises. If you're exercising your arms and you spend a lot of time exercising your arms and you build up muscle, what happens when you stop going to the gym and stop exercising? You go back to baseline. So it doesn't even make sense to do exercises on that level because otherwise the child would have to do the exercises the rest of his life. So we don't have a therapy to correct post-adenoidectomy VPI. The only way to correct that is through surgical intervention. So really what we would do is treat this in the same way as any other cause of VPI. It's going to require surgical intervention or a prosthetic device if surgery is not indicated. And in these cases, it's really important to refer again to a cleft palate or craniofacial team for a surgeon who has experience in VPI. Despite the fact that the child did not have a cleft, that would be an appropriate referral.